You're all very welcome, a huge warm welcome to you all here today to our Information Day for the metastatic breast cancer community. My name is Avril Coleman and I'm one of the nurse coordinators here at Ark House. I really want to acknowledge how hard it can be to turn up and that there might be some anxiety even around what you might hear today. For some of you, it might be your first time here at Cork Ark and you're also very welcome. And in that, I would like to just say a little bit about us. Here at Cork Ark, we aim to provide a safe and confidential space for both patients and relatives. Ark House is a very special place to work. Making a connection and being allowed into someone's lives when they're at their most vulnerable, when they might be frightened or sad or upset, it is a huge privilege and something that none of us ever take for granted. We also learn so much from the people who visit Ark, from you, and from your capacity to cope and be supported in adversity, and for allowing us to facilitate that. We are an adult service and provide support like counselling, reflexology, acupuncture, and then we have groups like Tai Chi, yoga, Pilates, mindfulness. We facilitate nationally run groups like the Thrive and Survive programme, and then also around the care of the family as a unit, we run a 6-week programme called The Climb, and that stands for Children's Lives Involve Moments of Bravery. And this is for children aged 6 to 11 who are experiencing the impact of a cancer diagnosis on a parent or on a significant adult in their lives. We run a 10-week programme called Mindfulness-Based Stress Reduction, and that's for people with a metastatic diagnosis. For breast cancer specifically, we have Fiona Moriarty, our breast cancer counsellor, who a lot of you might know well already. And Fiona facilitates one-to-one sessions, support groups, and information days. We've been fortunate also in Cork Ark to be part of the National Irish Cancer Society Women's Health Initiative, and particular with the Cork branch and the LISA trial. And we're delighted to have their lead researcher, Professor Roisin Connolly, will be here with us, Research Support Officer Kate O'Connell, and Kate is going to speak to us a little later, and more of their team are here today. The Women's Health Initiative is very supportive and inclusive of the patient's voice, and community supports like ourselves here at Cork Ark Cancer Support House to be part of really important support days and information days like today. Fiona and myself have been particularly proud to be representing Cork Ark and to see such wonderful work and research focusing on survivorship for women and improving their quality of life. Today's Information Day, Fiona, who unfortunately cannot be with us here today, was the driving force behind putting this day together, after collaborating with a group of women who are very dear to her heart. Pre-COVID, she asked them to design a day that would meet their needs, and this day is in response to what they told us. So it's centred around 3 pillars: hope, solidarity, and tools to live well. What was said that you're out there living and managing your everyday lives around treatment, but feel that the illness is difficult to talk about, and there's loneliness in that, and that you crave the freedom and the relief of normality within everyday relationships when the illness can overshadow everything at times. And we hope to open up a conversation about how to navigate the nuances of communication and how to regain a sense of self in that too. So today is a beginning, and from that we can shape another day. We have some wonderful speakers here today, and a very warm welcome to them all for coming and sharing their expertise with us. We wanted to bring together the people and support that you might meet in the community, but you wouldn't meet them all together. I will introduce them separately, but briefly, we have Dr. Deirdre O'Mahony, Consultant Medical Oncologist from the Bon Secours Hospital, Kate O'Connell, Research Support Officer with the LISA trial, UCC CUH, Dr. Fiona Kiley, Consultant in Palliative Medicine, and her colleague Irene Murphy, who's Principal Social Worker with Marymount University Hospital and Hospice. And then we'll have Sonia Lynch, our patient advocate. In the afternoon, we're going to have 2 lovely experiential workshops, and we'll just invite you to maybe pick one. We'll have mindfulness with Deborah O'Neill, and Deborah is a very experienced counsellor and mindfulness teacher, and Tai Chi with Anne McElwraith, who's our Tai Chi facilitator. And both Anne and Deborah have worked with us here in ARC for many years. I would like to both welcome and thank most sincerely Mary Barry from Roche Pharmaceuticals. They have sponsored this day, and we really could not have run that without their support. And also just to say that today's talks will be recorded, but only the talks, not the questions and answers, or not yourselves, the attendees. So I suppose just our wish, just for a few ingredients for the day, are that you know that there is support here. And just to remember that, maybe just to keep this a confidential space and just be respectful to others' views. We won't all have the same views. And very important, mind yourselves in it. And I hope that you will be able to relax and enjoy the morning. And there will be time for questions and answers before coffee and again before lunch. So if anyone feels they need anything, or if we can make you feel more comfortable in any way, my colleagues are all here today, and you'll see them dotted around there with name tags, and just feel free to approach them or chat to them at any stage, even during the breaks. I can see there Katrina, Carmel and Tricia are all down there at the end. And we're delighted to have our new head of services here with us as well today, Olivia Grace. So just a little bit of housekeeping before we start. I know people are worried sometimes about masks, but I think it's just very personal. If people want to wear masks, please do feel very free to be free with whatever you'd like to do. The exits are the door you came in, and if there is a fire alarm, there's an immediate to the left as we go out this door, and then the door you came in, and there's a door by the stairs. Toilets, I think most of you have probably found them at this stage, just beyond the stairs, and when we're upstairs, there's more right across from the group room. We'll have coffee, hopefully 11:15 for about a half an hour, and lunch 1:15 to 2:15. And you have your folders. In the folders, I'm sure you may have already seen, there's the programme, there's a little bit of information about studies, and the all-important evaluation sheets. I'll remind you about those later. So first up, we're delighted to welcome Dr. Deirdre O'Mahony, consultant medical oncologist in the Bon Secours Hospital. Dr. O'Mahony began her oncology training in Ireland in the late 90s. Then she moved to the National Cancer Institute in Bethesda in Maryland. I hope I pronounced that right. She continued there as a consultant before returning home to St. James's Hospital, Dublin, then Cork University Hospital and University Hospital Kerry, and more recently at the Bon Secours Cork Cancer Centre. Her speciality interests are in breast, lymphoma, sarcoma and melanoma. She is the immediate past president of Irish Society of Medical Oncology, chair of Lymphoma Forum of Ireland, chair of the ASCO International Quality Steering Group, and member of the ASCO Joint Certifications Committee. She co-founded the Irish Sarcoma Group and advocates for streamlining sarcoma services in Ireland. She's been active in clinical, academic and research programmes. And Dr. O'Mahony is going to talk to us today about research, clinical trials and novel treatments. We're delighted to welcome Deirdre. Thanks, Deirdre.